The number of COVID-19 cases is still rising rapidly across Canada. So too are the acts of defiance against pandemic restrictions. Public health orders are in place to try and keep our hospitals from being completely overwhelmed. Many already treating record numbers of COVID-19 patients, and intensive care units are being pushed to their limits. But in places like Calgary and Steinbach, Manitoba this weekend, there was a complete disregard for health measures. The Yourex-West looks at the pandemic pushback in our top story tonight.
Churchgoers at Steinbach, Manitoba's Church of God were defiant Sunday morning, lining the highway to take in a service over loudspeaker as RCMP blocked the parking lot. Under Manitoba public health order, even drive-in services are not allowed.
I believe in God, and I believe in our Constitution, and I believe in our Bill of Rights in Canada.
It's true that Canadians have a right to things like religious freedom, but during a public health emergency, those rights can be restricted if health officials feel measures are necessary to curb the spread of COVID-19.
In places where healthcare resources are so strained, like Steinbach in Manitoba, you really have to have public buy-in, obviously. You really do have to have people that are following and adhering to the guidance.
A rally in Calgary Saturday saw several hundred people gather in protest of provincial restrictions as well, even as Alberta doctors worry that measures announced earlier in the week don't go far enough. An Edmonton ICU physician says he sympathizes with protesters.
I understand it. I had to go out into the real world for an errand. I haven't done it forever. And the relief of just pretending it wasn't there was incredible.
Pretending, though, doesn't change reality and the very real human cost of ignoring the serious situation at hand. On Twitter Saturday, Dr. Markland shared in gut-wrenching detail the heartbreaking moment he had with a sick COVID patient just before she was put on a ventilator. He writes, "She catches me in a pause. Now her tears come in hot streams. She clasps her phone in her hand and lifts it up. Yes, you should call your son and husband. Just in case. More tears now, but now we are both crying."
The slow, inevitable progression of this disease allows us a little time to actually really be exposed to the humanity of this, and that's hard.
Made more difficult by the knowledge of what's to come. Thousands of daily new infections will mean hundreds more will need hospital care in a few weeks' time, filling up beds that are quickly running in short supply. Heather, Yourex-West, Global News, Calgary.